Therapy. I'm from Beva. Today I would like to presenting and tell about history of the theory counseling. In Malaysia, counseling service has reached an encouraging level, especially in school and institution of higher learning. This is aligned with economic, social, cultural, educational, and scientific and technological development. In the context of developing nation gearing toward a developed nation situation with high technology, counseling will be helpful to its people in various situations. Although counseling is regarded as a new field compared to sociology, economic, and psychology. As a whole, the influence of counseling is by society. The number of individuals who have sought to help of counselor to achieve more peaceful. And for the next is the direct effect to these changes on a person are psychological reaction in the form of stress. According to research, stress can cause various illnesses such as heart disease, high blood pressure, and emotional disturbance. Stress that may surface at the school level include unrealistic expectations of academic achievement by teachers and parents, small and crumbed living condition, and pressure from peers to adopt the certain behavioral norms. For the last one is counseling is defined as the principle and skill use of relationship. This is another definition of counseling is the facility of professional assistance and guidance in resolving personal or psychological problems. Here are the following are some definition of counseling. Which is we have these four. The number one is Crumbles, and number two, the American Guidance and Personal Society. Number three is Bulk and Satava. And number four is Gliding. So this is my part, and I already shared to you. I hope that you guys can understand what I'm presenting, and that's all for me. Thank you.
Hello everyone, today I'm thrilled to talk about history of humanistic therapy. Humanistic therapy emerged in the mid-20th century as a response to traditional behavior-oriented therapies. Carl Rogers and Abraham Maslow were key figures in the development of humanistic therapy. Carl Rogers emphasized empathy and unconditional positive regard in therapy. Abraham Maslow introduced the concept of self-actualization and a hierarchy of needs. Humanistic therapy focuses on personal growth, self-awareness, and self-actualization. Techniques like Gestalt therapy and existential therapy have enriched humanistic therapy too. Humanistic therapy continues to be a widely practiced approach in physiology, emphasizing individual uniqueness and personal growth too. It emphasized the uniqueness and potential of each individual, today supporting their personal autonomy, responsibility, and growth too. Nowadays, humanistic therapy offers a safe and nurturing space for individuals to explore their experiences, develop self-awareness, and work towards personal fulfillment and self-actualization. That's all from now. Thank you so much.
My name is Lavender, and I'll be presenting about theoretical assumption in humanistic therapy. Humanistic therapy is a talk therapy where it involves communication and also active listening. Humanistic therapy is a very positive, encouraging therapy where it allows the individual to know themselves, to explore themselves, to understand themselves, their potential, their capabilities of doing something, of achieving something. Humanist therapy, the assumptions, it believes of self-actualization, where the person realizes of their potential, their capabilities of achieving their goal, their targets, and to expand their full potential in under any situation. Um, it also focuses on the individual's nature, where it's not about what they are doing, like what's wrong with them, but how to use it in a positive way, how to make themselves positive. And knowing one's unique potential and capabilities will allow them to understand themselves even more, where they can actually grow more about grow the understanding of themselves. They can know the uniqueness of themselves, where it could be very beneficial for them in having a beautiful, fulfilling life, a meaningful life. For example, if someone is having different likings every time, like after some time they do like different thing, after some time they like different thing, in that case they tend to explore more, which I would say, because uh, having different likings every time would actually help them to learn a lot of new things. When they like something, they would definitely want to learn more about it, want to know more thing about it. So when they have this kind of characters, this kind of thing in them, this will definitely be useful for them in having knowledge, in gaining more knowledge about it. So sometimes this thing could be mentally affected on them. So having to know that this is actually a positive thing for them, this definitely will help them in having a better life, I would say. Thank you.
Hi everyone, I'm Rubashni Santanam. I'm here to explain you all about the theoretical assumptions in humanistic therapy. In humanistic therapy, there are several theoretical assumptions that form the foundation of this approach. One key assumption is that individuals have an innate drive towards personal growth and self actualization. Humanistic therapists believe that people have the capacity to make choices and take responsibility for their actions. And they emphasize the importance of self awareness and self exploration. Another assumption is that individuals have a subjective experience of reality, and their unique perspectives and feelings should be valued and understood. Humanistic therapy also emphasizes the importance of the therapeutic relationship, viewing it as a collaborative partnership between the therapist and the client. Additionally, humanistic therapy assumes that individuals have the potential for positive change and growth, and that therapy can help facilitate the process by providing a supportive and non judgmental environment. The focus is on the present moment and the client's immediate experiences rather than dwelling on past events. These assumptions guide the humanistic approach, the therapy, which aims to empower individuals, enhance self awareness, and promote personal growth and well being. Thank you.
Moving on, I will be discussing the techniques used in humanistic therapy. The first technique is the confrontation technique. This can be described as a direct technique in which the counselor challenges the clients to face themselves realistically. The purpose of the confrontation technique is to prevent harmful cycles to be repeated less frequently or not repeat at all, to ensure that they are practicing healthy lifestyle habits into their daily life. It helps break through the defense system, which is known as denial. The second technique is the use of language. It explains that the counselors need to be able to encourage change in their client through words, phrases, and questions. This could be shown in 5 concepts. The first is to focus more on the statements instead of the question to ensure a client-therapist relationship is being created as a result of more collaboration from both sides. Second is the incorporation of the words how and why in questions to make sure that the client can navigate through their feelings and thoughts. The third is focusing on ownership and accountability to what you're feeling and doing by using the words I in statements. Present tense is also important for the counselor to use when speaking with the client because it acts as a pivot to the client's behavior and to be on the right track for positive change. Lastly, responsibility towards the mindset, feelings, and behaviors towards different situations so they are able to learn and accept what they are feeling. The last technique is unconditional positive regard, and it is known to hold a positive view of yourself and your potential. An example of unconditional positive regard can be seen through a parent and child relationship, where the parent will care and love for their children no matter what, especially when they are still young and making mistakes. The purpose of this technique is to create a comfortable relationship between the counselor and client so that the conversations can flow better and the client can let their guard down, which can result in a better conversation between the two and can lead to a more effective journey for the client. More importantly, counselors should try to implement this into their sessions so that the clients do not feel judged.
Hi everyone, I'm Shishika Srikaridesan here. Today I'll be explaining about humanistic therapy skills. The humanistic theory approach engages social skills, intellect, feelings, practical skills, and artistic skills, and more as part of their education. Basically, the elements in their humanistic skills were self-leadership, personality development, basic social integration, and self-discipline, and problem management too. They emphasize characteristics that are shared by all human beings such as love, grief, caring, and self-worth. The humanistic skills identified by the students were leadership, personality development, social integration, work element, and work management and self-discipline. The main element of self-leadership was categorized by 5 elements, which is self-discipline, positive manner toward change to act independently, which is sincerity being responsible to any action taken on cooperation, where the element of self-discipline had been provided as most important training by SMI compared to another element of skill. The second main element was personality development. The main another element were categorized by 3. The element were learning from mistakes, portraying self-confidence and teamwork, where the element of learning from mistakes had been provided as most important training by SMI compared to another element of humanistic skill.
Hi everyone, my name is Mirashi and I'm from DTESL. My part in this assignment was to do the application of theory to resolve clients' problems. When applying theory to resolve clients' problem, the process involves understanding the theoretical framework, analyzing the client's specific situation, and the client's real life changes. Theories provide a framework that guides the therapeutic process, helping to understand a client's behavior. A counselor can develop strategies and inventions that are both effective and personalized. It's like a roadmap that shows you how to navigate through the client's experience and find the best path to their well-being and resolution of their issues. So I think that's all from me. Thank you so much.
Hi, I'm Deepika Subramaniam. I would like to talk about application of humanistic therapy to resolve client's problem. The first issue is address low self-esteem. When a client is esteeming their self as low, the therapist can create a secure environment so they can help them. Second is helps with the decision making difficulties. When a client is having difficulties in decision making, the therapist can help the people to realize their greatest potential and advise them to take a good decision in their life. Third will be address interpersonal relationship challenges. Acknowledges the significance of positive interpersonal interactions for individual development. When a couple's having problem in their relationship, the therapist can give some advice so they can have a happy life. Thank you.
Hi everyone, I'm Tanisha and I'll be proceeding to the humanistic therapy of criticism that can be found in this therapy. So one major criticism of humanistic therapy is that it's too the concept is too challenging to measure because some critics actually argue that the subjective ideas such as like any source of authentic or real experiences are difficult to objectify, and at the same time, any source of experiences that is real for one may be not real for another person. So for instance, if a person A is saying that dealing with serious mental health condition may be a serious thing for him or her, but the person B could say that this is actually a piece of cake, or not something that is really essential for them to actually measure. So, which is why some of them actually argue that it is really hard to objectify, because in this field, humanistic therapy actually has been criticized for being too focused on the good and ignoring the other side of, like, the negative side of human beings. So, what I'm trying to say that is, whatever that cannot be considered in this therapy, is considered as critics, and at the same time, it is measured as overly nebulous, because um, based on some research, they say that it is really ineffective to actually address any source of, like, qualitative data, to actually collect data from one another. So, in a nutshell, I would say that humanistic therapy and the critics that it is, from this therapy, is not defined enough, because self-accusation is also part of, like, the pinnacle of human growth, and the critics from this human therapy is also contend that, due to the philosophy of humanistic therapy, it is incorporating too much of common sense and insufficient of objectivity, which leads to, like, which cannot be actually considered as an appropriate field of study as a result of naive assumption of human nature. So these are the criticism that can be found from this human therapy. So that is all from my side.
So my name is Muhammad Hafiz and I'll be presenting about the criticism in humanistic therapy. Humanistic therapy, often associated with figures like Carl Rogers and Abraham Maslow, it emphasizes personal growth, self-actualization, and the importance of the individual's subjective experience. While humanistic therapy has its merit, it is not without criticism. So here is a few examples of it. So for the first one, it is subjectivity and lack of structure. So the humanistic approach regularly values the subjective encounter of the client and emphasizes the significance of self-discovery. Fault finders contend that this need of structure and direction may not be reasonable for all clients, particularly those who may benefit from more order and organized helpful approaches. So for the second one is individualism. Some critics argue that the individualistic nature of humanistic therapy may inevitably contribute to the stigma associated with mental health. By focusing on personal responsibility, it might imply that individuals can overcome mental health challenges solely through their own efforts, and potentially undermining the recognition of mental health as a complex and multifaceted issue. For the third one, the concepts of humanistic therapy are too vague. Critics argue that subjective ideas, such as authentic and real experiences, are difficult to objectify. An experience that is real to one person may not be real to another. Therefore, critics believe that conclusions drawn from subjective experiences are almost unverifiable, making research in humanistic psychology unreliable. In addition, critics argue that humanistic psychology is not a true science because it involves too much common sense and not enough objectivity. And lastly, humanistic therapy is limited to severe psychopathology. Humanistic treatment is frequently criticized for being less compelling in treating serious psychopathology compared to more organized and ordered approaches like cognitive behavioral treatment. A few fault finders contend that it may not give the vital devices and methods for tending to intense mental well-being issues. For instance, clients with conditions such as schizophrenia or extreme identity disorder may require a more organized, helpful approach, like argumentative behavioral treatment or medicine administration, which humanistic treatment may not give to be essential as 10 issues. So that's all from me. Thank you.
In conclusion, the history of humanistic therapy marks a significant shift in psychology towards a more person-centered and holistic approach to mental health, with influential figures like Carl Rogers and Abraham Maslow leading the way. Humanistic therapy emphasized empathy, personal growth, and self-actualization. Techniques such as Gestalt and extension therapy further enhance this approach, providing individuals with a safe and supportive environment to explore their inner experiences and strive for personal fulfillment. The enduring impact and relevance of humanistic therapy lie in its promotion of individual empowerment and self-awareness, making it a valuable and widely practiced therapeutic model in the field of psychology. The history of humanistic therapy showcases a significant shift in the field of psychology towards a more person. This rich history highlights the enduring relevance and impact of humanistic therapy in promoting individual empowerment and self-awareness in the realm of mental health treatment. Thank you so much.